I hear this with liposuction patients all the time. Do I avoid salt after surgery? And the concern is that if you intake a bunch of salt, it's gonna make you swell, and then it's gonna be more uncomfortable and you're not gonna have as good of results. So like, I get that, that makes sense, but we know that over time, as you lose something, your body's gonna need to have that replaced. So, you know, drinking a bunch of water after surgery, you're not leaking water from your liposuction incisions, right? Like it's more of like a serum. It's more like plasma, you know, and that's not pure water. So just drinking water doesn't do enough to replace that. I've had a lot of patients that if they're just drinking pure water, they find that they're getting really lightheaded, and it's because they have water in their system, but they're not properly hydrated. In the same way that if you go to the hospital and you're dehydrated, they don't give you water to drink, they give you an IV. And what's in the IV? Salt, right? So you need salt to maintain your blood pressure for normal bodily functions. So I think the things that patients are missing out on when they're only drinking water, they're not getting enough sodium, they're not getting enough potassium, they're not probably getting enough calcium, magnesium, and probably phosphate. The other thing to consider is that if you're not getting those things, it can make other processes in your body kind of wacky. It can make you feel kind of jittery. It can make your muscles kind of cramp up. You know, like if you don't have enough potassium, you get a cramp or a Charlie horse. They tell you eat a banana because it's got potassium. So I guess I want to do away with this myth. I think that we know from studies that patients' sodium, potassium, calcium, and magnesium go down over the first 24 hours after surgery. I don't tend to see patients having electrolyte issues in the first 24 hours. It seems to be more like days 3 or 4 afterwards. They start getting a little bit dizzy, a little bit lightheaded. The room's kind of spinning as they stand up. And that's when your swelling really peaks out. So the first day or so, everything typically looks pretty great. You know, things have kind of shrunken down from the compression garment, you've drained a lot, and then you get into like the real serious swelling. The thing about swelling is that your lymphatics in your skin and your tissues don't work very well after liposuction. They come back eventually, but initially they don't work very well. So if you've got this like lymphatic stasis or impairment of your lymphatics and they're not working very well, it's going to tend to create like a sludge in the operated area. So you're not clearing away stuff, you know, let's just call it stuff, sludge, whatever you want to call it, lymphatic fluid. If that's not clearing out, that is higher concentration of salt than water. So it's going to tend to attract water into it, and that's going to cause swelling. So as you are drawing fluid in, it makes you a little bit dehydrated, and it can mess up your electrolyte imbalances. This doesn't even take into consideration all the stuff that's leaking out of you, which again is like a plasma or a serum, and it's more of your body's composition of fluid, not water. So I think my patients, I prefer that they use electrolytes afterwards. I don't think water is actually very hydrating for them. I encourage them to drink electrolyte powders that contain sodium, potassium, chloride, magnesium, calcium. I think taking vitamin D after liposuction is really important. You suck out all this fat, that's where vitamin D is stored. You need to replenish it somehow. So I think that people that try to avoid salt after surgery, I get it, I think it makes sense, but I think it's really rooted in something that's not strong science, and I think there's a lot of reasons why it's worth reconsidering. I think with things like surgical recovery, there's some things that just make sense, and then there's things that actually work. I think it's important to re-examine some of these things that we think make sense. Oh, I don't want to swell, so I'm not going to eat salt. Okay, well, like that sort of makes sense, but in reality, you need these things to power your body's processes and normal functions. And I think by avoiding them, you might actually set yourself up for a worse recovery because you're going to get more swollen or you're going to get lightheaded and then fall down. So I think it's important to talk with your doctor about what type of post-operative care that you're going to get in terms of what's the plan for my hydration, how much do I need to drink, what do I need to be drinking, what am I going to be missing that I need to replace. You know, in plastic surgery, we're always talking about replacing like with like, meaning if you lose something, you're trying to replace that or fix that thing. So if you're doing liposuction and you're sucking out fluid and then you're causing all this leaking afterwards, that's not water. You know, it's important to replace it with what it actually is, which is a fluid with electrolytes, with protein. So that's the things that I would encourage you to do after surgery if you're one of my patients, is to have high protein intake and then also to increase your electrolytes probably more than you think you need to, so that you get a good recovery and you're not feeling lightheaded and dizzy.